Welcome to Skin of Color Savvy, the art and science of treating patients with skin of color, the official podcast of the Skin of Color Society, hosted by SOCS leaders and produced by HCPLive. I'm Dr. Seemal Desai, a past president of the Skin of Color Society, but most importantly today, here as a dermatologist passionate about pigment. And today I'll be hosting this Savvy Conversation episode focused on a topic that is both complex but also deeply relevant to our specialty, called pigment policy and perception. The importance of understanding the nuances of everything from skin bleaching to appropriate management of pigmentary disorders. I'm joined today by a true pioneer in our field, Dr. Pearl E. Grimes, a globally recognized dermatologic expert and leading international authority on vitiligo and pigmentation disorders, and most importantly, a very dear friend. Dr. Grimes, welcome. And would you please give the audience a little bit of your background?
Seemal, it is truly my honor and pleasure to join you for this session. And it is always my honor and pleasure to partner with you because, as you said, we are certainly colleagues, compatriots in the pigmentation space, but it is also wonderful to partner with my colleague, my brother, and my friend. So, regarding my story, Seemal, as you know, I have been deeply involved in pigmentation research for over 45 years.
Great.
We started in the arena of vitiligo, then we expanded to other disorders of pigmentation. So, this really is my passion. I tell people it's a part of my soul and my identity at this point. So I'm really excited today to talk about colorism and the impact of colorism
Mhm.
around the globe and how colorism impacts our approach to pigmentary disorders. I'll digress for a quick moment. I am the
Please do.
founder and director of the Vitiligo and Pigmentation Institute of Southern California. I am the recent founder of Pearl, the Melasma Research and Treatment Institute, and we're so honored to have you on our advisory board. And I'm also a clinical professor of dermatology at UCLA. So, Seemal, let's just take a deep dive into this topic.
Let's dive in. But Pearl, you wear so many hats. I don't know how you do it, but you do it. You show up flawless and always perfect. So, truly an inspiration, not only for me as my sister, but for all of us in dermatology. And I couldn't think of a better person to tackle this, frankly, controversial topic. And you alluded to it beautifully. So let's dive in because when we talk about colorism, we're by definition referring to an inherent bias or perceived preferential treatment or perceived perception based on skin tone, which is often in one racial or ethnic group. But thinking of it also more broadly, how do you think colorism affects patients' perception of pigmentary disorders, especially when they look at access to care, how to treat pigmentation, how it's viewed culturally? What do you think are some of the nuances that we see that sort of blur the lines between pigmentation from a medical perspective and colorism based on cultural and preferential nuances?
Samal, this is such a complex global topic
Hmm.
because if you go around the world, we could ask, well, why are we dealing with colorism? And I think for our listeners, it's important to place it in a historical perspective, historical context. So, we see it in America. If you look at migratory patterns in Europe and the diversity of the European population, we now see it in Europe. We see it in Africa. We see it in the Middle East. We see it in the Far East. We see it in South Asia. We see it in Indonesia. And as you said, it's preference for a particular skin type. So we know that some of it's grounded in colonialism,
Right.
in colonization of various populations around the world, the enslavement of populations, and the quest to identify with the enslaver. And I have to go there. But we
Yeah.
also
Right.
know it goes beyond that because we can go to the Far East, where this was never an issue, and colorism is still a key part of the culture. Okay. And I think in those populations, it's grounded more in class, who works indoors, who works outdoors, and all the connotations, permutations that go with that. But I think at the end of the day, as you said, colorism is that quest or that the societal concept of having a preference for lighter skin and all the issues that go with that preference for lighter skin, economics,
Yes.
professional advancement, marital status.
So glad you said that.
So colorism has so many permutations and nuances that impact people societally at so many levels. So, how do we address it in the House of Dermatology? And very often, when you think pigmentation, pigmentation can have so many positive connotations. If we just look at pigmentation morphologically and biologically, I think we can make the statement that darker skin ages in a different way.
Right.
If you look at chronologic aging, photo damage, but that's kind of completely lost in the colorism paradigm. Doesn't
And
make
you're so, and you hit on everything and more. And just to give one tangible example, just from my own personal background from an Indian Asian origin, in India we have the caste system, which has been around for thousands of years, which is a frankly archaic, outdated, very divisive system that classified people. And one of the things it's taken into account over the years is skin color. And the lighter and fairer your skin, the higher you were viewed in society, in marriage proposals. That was the big one. Then came education and opportunities and jobs, but it was really meant to be a social stratification schema, and it goes to colonial days. There's actually pieces of French ancient art. There's pieces of even Greek and Roman Neolithic art that highlight these trends that are pervasive along many cultures. But let's go now a little bit more into our world, especially when we think about treating hyperpigmentation, melasma, PIH, lichen planus pigmentosus, acanthosis nigra, all of the things you and I do. There are also times when patients come in wanting to be treated for a pigmentary disorder where the lines get blurred between wanting to make their whole skin fairer and whole skin lighter. That concept of skin lightening for medical reasons versus skin bleaching for cultural colorism issues. And I wanted to get your take on that.
You're absolutely right. I don't think, Seemal, for any of us who work in the arena of pigmentation, particularly in those conditions that are characterized by darker patches rather than lighter patches. So we're all vested in achieving the best outcomes to eradicate the areas of hyperpigmentation, to make that patient their natural, even skin tone. But we all see patients, and I think you would agree with this, where the borders, the boundaries are blurred. Okay. And what do I mean by that? In the quest to have even skin, uh, in our quest to minimize the burden of hyperpigmentation, and the patient's quest to have even skin, there's still the backstory.
Yes.
Okay, and I'm going to call it the subliminal, or it may be conscious, but it can also be subliminal. That little bee in their bonnet that's saying, you know what? As I treat my true pigment imperfection, I am also going to address my skin tone,
Right.
this stigma of colorism, okay, and the inequities of colorism that I deal with every single day in my life to make my skin tone lighter overall. Uh,
I've seen it, you've seen it, and you're absolutely right. In fact, your example reminded me of melasma patients who come in and say, well, I want my melasma treated, but how about we make my whole face look more fair?
exactly. And so I think the challenge for us as caregivers, clinicians, to how do we meet the patient in the journey?
Right.
How do we address the issue of colorism as we continue to address the core pigmentary issue and work with them from an emotive perspective to say, look, you're beautiful. Okay. You have gorgeous skin. Just let's make you the best version of you. Okay. Because if I lighten your skin, if we go down that road, it's temporary. Okay.
Right.
Your inherent skin tone is your inherent skin tone. And if we go beyond that with aggressive measures, then the consequences of what we are doing vastly transcend the benefits of any treatment that we have to offer. And so I think that's the ongoing struggle for us as caregivers in helping the patient view this through a different lens and the horrific negative impact that it has on their self-worth and self-esteem. And it's not easy. It's
No.
really, really complex. But when I see it, do I ignore it? No, I don't. I really try to have that conversation with the patient. Now, we know there's always someone out there to address what you want, particularly in the arena of cosmetics. But at least we can say, you know what? I I really did everything that I could conceivably as a caregiving physician through the medical lens, the emotive and the psychological lens to address this with my patients.
And addressing it with the patient is so critical. So that's a perfect segue to talking about education and advocacy. And I could talk, you and I could talk about both of those topics for hours. But when we think about education, one of the things that I think we have to do is when our patients come to see us, we have to ask questions. We have to ask them, are there over the counter lightening creams? Are there things you've bought in other countries? Are there things you've bought online? What about brightening creams? A lot of times you'll say, have you used something for your pigment? They'll say no. Well, when you deep dive, what about moisturizers? What about skin serums? these questions are important because in many parts of the world, topical steroids, high doses of hydroquinone, arsenic, and mercury containing products all are available disguised as beauty creams. So, education of our patients through our interaction in the room, but also through social media, through podcasts like these, through more conversations is so important. So, I want to get your opinion on that. And then the other thing I wanted to share with our viewers is that there are now many regulatory bodies, such as the FDAs around the world in respective countries, who have finally cracked down on counterfeit skin fairness and beauty products that contain these ingredients. These trends are rampant in Southeast Asia and most rampant in West Africa. There's an epidemic in Nigeria. People have died because of percutaneous absorption of arsenic and mercury from skin bleaching that leads to systemic toxicity. We published just a recent JAD paper on this. Dr. Grimes and I authored this paper with two of our co-authors. That has now been published in the JAD, which is a follow-up to our 2021 paper. There is a lot of work that needs to be done. And then we'll move into advocacy. But Pearl, I want to stop there and get your take on that.
So Seemal, I am in total agreement with everything you've stated. I think it is super important when you see patients in these in an initial consultation to really query them on what they're using. Uh, at every level. What is your moisturizer? And very often, if I'm not clear on it, I will have patients bring in the container, or
Absolutely.
I will tell them, okay, pull it up on your phone.
That's exactly
Okay,
right.
pull it up on your phone. Now let's flip to the ingredients. And if we can't do it, my next response is just so that I have clarity on what you're doing, bring it in and I will review your products with you. So that's number one. Number two, I agree with your comments on what happens in West Africa, what happens in parts of India. Patients
Hmm.
use whether it becomes a cultural phenomena in
Absolutely.
using some form of lightening to address the societal issues of colorism, and they use the products on a daily basis. One comment I'd also like to make is IV glutathione.
Absolutely.
There are clinics around the world, and we've seen the emergence of these clinics in the United States where
Hmm.
patients go in to get IV glutathione concoctions, and I'm going to call them concoctions, okay, for skin lightening. And if you look at what has been published in the literature, IV concoctions of glutathione have been shown to cause horrific anaphylactic reactions, erythema nodosum, Stevens-Johnson syndrome. So these are not benign, inconsequential treatments. And we
Yep.
recently had a patient who was on very, very high doses of oral glutathione for an extended period of time, and we were suspecting it triggering her very severe, extensive vitiligo.
And I remember that case you shared with me because oral glutathione isn't even highly bioavailable, and this patient still had this reaction. So we have so much work to do, and I think that leads us to our final message on advocacy. And advocacy is something that, Pearl, you and I have really dedicated our careers to, which is working with regulatory bodies, with organizations like the Skin of Color Society, like the AAD, like the Global Vitiligo Foundation, like the ILDS, so many more, that we've got to talk about colorism. We've got to talk about skin bleaching, and we do not want to do it at the peril of appropriate skin lightening being harmed.
I agree with you. And so I think advocacy is key. I think the Skin of Color Society, the Global Vitiligo Foundation, I think all of the bodies that advocates for individuals who may, I don't want to use the word victim, but what I will say is their societal environments may subject them to the issues of colorism in their unique societies. But I think it's our job to partner with patients so that we can disseminate active information in spreading a global message of the horrific and harmful effects of colorism at a global societal level. And we must take patients beyond, because I just think that for every man, woman, and child on this planet, when you look in the mirror, you have to see the beauty of your color, your face, your soul, and every aspect of who you are. And we don't want it to be shrouded in a societal horrific stigma of what our ancestors have perpetuated.
Pearl, I don't know a better way to end the conversation than that, because you sharing your wisdom, your experience, and your leadership on this critically important topic has so been important in the conversation. I want to thank you, Pearl, for joining me. I can't wait to continue this discussion. And to our listeners, we hope this Savvy Conversation episode encourages deeper reflection and meaningful action in your own practice. And to learn more about the Skin of Color Society and all of our work, visit skinofcolorsociety.org, and be sure to follow the Skin of Color Savvy series for future conversations centered on advancing equitable dermatologic care. Thank you for listening, and we look forward to seeing you on the next episode.